Perfect. You can see you're just going to be the star of the movie. All right. So today we're going to cover the rotator cuff muscles. Okay. You need to know these. This is going to be the rotator cuff muscles. Okay. Do you have any idea why they're called the rotator cuff muscles? They control rotation of the shoulder. Correct. Okay. And when we're talking about rotation, what bone are we specifically talking about rotating? Not the scapula. Humerus. Okay. So the humerus is the bone that's going to be doing our rotation. So everything we do is in reference to the humerus. Okay? Now, we do have an acronym that we can use, and it's SITS. All right? So we have S, I, T, S. Okay? Do we have any idea what those might stand for? All right, so we have, yep, Teres minor is one of them. Maybe I do need somebody. Come on, Caitlin, come film class. You volunteered. All right, so we have Teres minor. Supraspinatus. Subscapularis.
Can I like stop this and get it so we can look at the others? No, I don't really care. Okay.
And what other one?
Pause it and then flip it.
Infraspinatus. Okay, so this is our rotator cuff muscle. What I do want you to know is that there is a teres major. It is not a rotator cuff muscle. Okay? It is not a rotator cuff muscle. So make sure you remember that it's teres minor and not teres major. I can guarantee you I will ask you that question. Okay? All right. So let's talk about what these muscles do. Okay? Well, let's see if we can figure out where they are first. What do you think? Where do you think the subscap is? It's on your back, but what does sub mean? Under. Okay? It's under your scapula. Okay? Or in this case, it's going to be anterior to the scapula. So it's in the front of that scapula. Okay? What about supraspinatus? Where do you think that is? That is where it is. But what does supra mean? Superior means top. All right? What about spinatus? What are we talking about? Spine of the scapula. Good. Okay, so it's above the spine of the scapula. And what do you think infraspinatus means? Below the spine of the scapula. Okay? What we have for these is we have an infraspinatus fossa, and we have a supraspinatus fossa. Do we know, do we remember what a fossa is called? Or what it's for? What it stands for? Yeah, it's like a hole or a divot or a cutout. So if we take a look at our friend Scully here, all right. Spine of the scapula, okay. Supraspinatus fossa, all right. Infraspinatus fossa, all right. So it's just that hole that sits above and below the spine of the scapula. Does that make sense? And in the subscap is going to be in front of the scapula, okay? Now, teres minor, why do you think it's called minor? Why do we call muscles minor? They're either smaller or they're below another muscle, correct. This is both small and below the teres major, okay? All right, so let's start with the most difficult one. We'll start with the subscapularis. Okay? Subscapularis is going to be in the subscapular fossa. So once again, we have a fossa that sits in front of the scapula. So subscapular fossa is where it's going to originate. All right? It is going to come around and insert on the lesser tubercle of the humerus. Okay? What are we talking about when we're talking about tubercles? Does anybody remember? Anybody know about tubercles? Tubercles are going to be a bony attachment for muscles. Okay, so if we have a tubercle, it's going to be a bony attachment for a muscle. Now the lesser tubercle sits right here. Okay, so the subscapularis comes underneath. It's kind of hard to do it because of the spot, because of the rib cage, but it's going to come underneath the scapula. It's going to go through and then attach right here. and that's going to be its insertion point. All right? Its job, okay? So we have a guess is what it's going to do. If this muscle shortens, what's it going to do? Medial rotation or internal rotation, okay? Medial rotation or internal rotation. So when this muscle shortens, remember the insertion always moves toward the origin. So when this insertion point moves toward its origin, it's going to internally rotate, okay? That is the only job of the subscap. It's to medially rotate. So you can say internal rotation or medial rotation, they both mean the same thing. All right? Let's talk about the other muscle that does some rotations. All right? So we have two that do, so I want to make sure we understand. We have two muscles that do, so we know that supraspinatus is internal rotation. Or not supraspinatus, I'm sorry, subscapularis. Internal rotation. It is the only one that does internal rotation that we're going to talk about. Okay? We have two that do external rotation. And we have one that does abduction. Okay? So we'll get there. All right? Let's start with one that does external rotation. And we're going to start with the teres minor. Teres minor is our most commonly injured rotator cuff muscle. It's the one that we typically see hurt in our overhead athletes. All right? It's going to be on the axillary border of the scapula. Okay? Where is axillary border again? By the armpit. Good. All right? So we're on the back again. Turn Scully around here for us. All right? So it's going to be on the axillary border of the scapula. It's going to be below the spine of the scapula. Okay? Axillary border is going to be its origin. The insertion point is going to be the greater tubercle.
Hey, that's the wrong border. Your point.
Axillary border. Axillary border of the scapula, and then we're going to the greater tubercle. Okay? Thanks, Tyler. You have video evidence of me screwing up now.
Yeah.
All right? So axillary border to the greater tubercle. Now, what's the difference in the greater tubercle and the lesser tubercle? It's going to be the side. So the lesser tubercle is going to be here. Greater tubercle is going to be here. It can also mean whether it's above and below, just like you were talking about, Kenny. All right? So we're going to the greater tubercle. When that muscle shortens, it's going to control external rotation. Because it's on the axillary border, because it comes over and attaches to the greater tubercle, it's going to do lateral rotation or external rotation. Okay? Now, the other muscle that's going to do external rotation for us is the infraspinatus. Okay, infraspinatus is in the infraspinous fossa of the scapula. All right, so the infraspinous fossa again. All right. And it's also going to the greater tubercle of the humerus. So we have two muscles that are originating in very similar spots. One's just going to be on the axillary border. The other is going to be in the infraspinous fossa, but they're both going to the greater tubercle of the humerus. Okay? So it's also going to do that lateral rotation. Very similar, both on the back side of the scapula. All right? They're both controlling lateral rotation. All right? And then our last one is our simplest one, and it is the supraspinatus, and it is abduction of the shoulder. Abduction or abduction. Okay? It also goes to the greater tubercle. So its insertion point, once again, is on the greater tubercle. It comes to the supraspinous fossa. It's going to go underneath the acromion. And that's really important to note. Okay? We have an injury that we call impingement. All right? Shoulder impingement. Typically when we talk about shoulder, when we say the word impingement, we typically think of a nerve. In this case, shoulder impingement is going to be specific to the muscle being impinged. Okay? Or the muscle having friction against the acromion. So this supraspinatus is going to go through here, and it's going to insert on top of the greater tubercle. Okay? It's going to control nothing but abduction of the shoulder. Okay? All right, so let's partner up. We're going to find these muscles. You can palpate all of them. All right, they can all be palpated, and we're going to figure out how we do that. So bring me a dummy and grab your partner. Somebody come on up here. Get with your partners. Don't move too fast. Turn around. Hmm? I'm sorry. This is great. We'll just keep moving Tyler everywhere. Are you starting right now?
Yeah.
Oh, I gotta be nice to him. O-line?
Yep, right guard.
All right, ready? Are we ready? Hello? Hello? Okay. So, first thing we gotta do is we gotta find the spine of the scapula. Okay, everybody find their spine of the scapula. Make sure we can find that. If we finger roll down one, we're going to be right on top of the infraspinatus. Okay? The infraspinatus controls external rotation. So, if I want to make the infraspinatus pop out, I'm going to resist my patient into external rotation. So I'm going to push it back against me. All right? You should be able to feel the infraspinatus pop out. Okay? It should pop out right below that spine of the scapula. If I want to look at supraspinatus, we're going to do what we call empty can. Okay, we're going to take our Coke can, we're going to pour it out, right in front. Do not come across. This is a completely different test. Okay, but we're going to do empty can right here at about a 45-degree angle in front of the patient. Have them right here. Don't let me push you down. And you'll feel the supraspinatus pop out on top. Now, if you come out here to the side, you can also do that, but the thumb needs to be up, okay? If you rotate here, okay, you're still going to get some supraspinatus help. If I'm thumb up, I also got to keep in mind that my deltoid's going to be working, okay? So we got to be able to isolate the two. This is why we bring them into the 45-degree angle. If I bring them into a 45-degree angle, the only muscle that can work is the supraspinatus, okay? So we isolate that. Once again, if I want to feel my other external rotator or my teres minor, I'm going to find my spine of the scapula, finger roll down, I've got infraspinatus. One more down, I've got teres minor, teres major, okay? Have him push back against me, I can feel his teres minor right there pop out, okay? So we want to make sure that we're able to feel that. What border is the origin for the teres minor? Axillary border, unless you're me and you're going to point to the vertebral border. All right. So the next one we're going to find is subscap. Cannot palpate subscap.
Yes.
I can palpate the insertion point of the subscap. I cannot palpate the origin. Why can I not palpate the origin? Yeah, you can't feel through somebody's ribs unless you're magical. Okay? What?
That we do in lab dissection.
Dissection.
Yeah.
Perfect. Okay, someone go give me a scalpel.
Yeah, no, no thanks.
What? Taylor wants to dissect? You can go turn around here now. So we're looking for lesser tubercle. Okay, how am I going to find lesser tubercle? So I know? All right, so if we want to find lesser tubercle, have the patient here. I'm going to make him resist me here. I can find the bicipital groove. Okay, so now relax. Find the bicipital groove. I work one over. That's going to be the medial lip of my bicipital groove. If I roll down, I've got the lesser tubercle. All right, so now I want to feel the subscapularis. So I'm going to resist him into internal rotation. Push against me. There you go. And it pops out. See that pain right there that I'm giving you? That,
No.
It's not hurting? I got to push harder. We get in there. All right? That should be subscap. Okay? What muscle is sitting on top of the subscap that's going to make it hard to feel? the major subscap. We've already covered this muscle. It's a big chest muscle. Pec major. Yep. Where is pec major insert?
It inserts at the
medial third of the.
That's its origin.
You said
at the bicipital groove.
What part of the bicipital groove?
The
Lateral lip or medial lip?
me.
Lateral lip.
Oh,
Good. All right, so it's going to be in a lateral lip. So if we're looking for medial lip, it's going to be hard to get in there. So just make sure you know that. But it should bulge when you're trying to do internal rotation on the patient. Okay? All right, so let's all go ahead and partner up. Let's make sure that we're going through all the ranges of motion. Let's do the manual muscle tests on our patients. Okay? Make sure we get what that feels like. Make sure we are palpating our patients. Are we good? All right, I'll walk around and help.